One of the most common misconceptions surrounds the mini tummy tuck or the mini abdominoplasty, which sounds really cute and I'm not that overweight, I just need a little tummy tuck. But that's not really what it is. What it means to me as a surgeon or any surgeon is we make the incision down low, we lift the skin up only to the level of the belly button. We can put a few stitches in if the lower part of your abdomen is bulgy, and we can pull down and get rid of a little bit of the extra skin down low. It has nothing to do with the length of the incision. So if all of your problem is belly button down, which happens very rarely, I'm a board certified plastic surgeon. I don't know anybody who does more tummy tucks than I do. I do up to 200 a year. I've been in my private practice, this is my 27th year. I guess I've done about 3,500 or so abdominoplasties. And in that time, the number of mini abdominoplasties I've done, 2. So it's very unlikely you're a candidate for a mini abdominoplasty, but in some cases that would be an option. Another type of tummy tuck is what I call the modified abdominoplasty, or the umbilical float. So what does that mean? That means that sometimes you're kind of in between. You have more than just the little mini abdominoplasty amount, but you can't get rid of all the skin from the belly button down to the incision line. And so what you can do is you leave the belly button attached to the skin, you lift everything up, sew the muscles together, and then you pull down just the extra loose skin and reattach the belly button from the inside. So that only works when it's a small amount of movement. You don't want to have a belly button that's too low. So some people have high belly buttons. Sometimes we use this procedure when somebody's had a tummy tuck with not great results elsewhere and we need to lower the incision. There are certain circumstances in which a modified abdominoplasty might work for you. I would say out of the 3,500 or so that I've done, I've probably done 100 of those. So more likely, but still not common. And then there are bigger procedures. There's the inverted T, where if somebody has lost 300 pounds and you're pulling the skin tight this way, sometimes there's looseness side to side as well. And so sometimes a vertical incision needs to be made to pull in the skin this way. Advantage, really nice waist, maximal skin removal, maximum tightness. Minus, you have a big line down the middle of your stomach. So whereas in an abdominoplasty well performed, you can wear a bikini, nobody sees anything. If you have a line down the middle of the body, no matter how well it heals, you can usually see something. And so that's only reserved for special cases. And then for bigger procedures as well, they have a fleur-de-lis where there are extra incisions or circumferential around the body as well. So there's a whole smorgasbord of abdominoplasties out there, but I would say that 99% of the time it's a standard abdominoplasty that you would require.